Hi, thank you for taking some time to join us today for our webinar on collections. The title of our webinar is Simplifying Your Collections and Payment Process. I am your host, Tony Peterson. So before we begin, we know that there may be some questions that come up during the webinar for many of you. To ensure that all questions are answered promptly, we'll ask you to please either write down or remember your question for later. And at the end of the presentation, we'll have 15 minutes where we will have it set aside for question and answer. So why don't we go ahead and get started with today's presentation. Those of us that are working within the healthcare industry, perhaps nothing keeps us up late at night more than the lengthy, time-consuming, and expensive process of collections. Delinquent bills, monies owed for services, you get it, you deal with it every day. Nurses, practitioners, and doctors all need to get paid for the services that they render. And despite the taxing and sometimes grueling nature of collecting payments from truant bills, the reality is that healthcare collections have been and will continue to be a major and valuable revenue stream for all healthcare providers who take appropriate actions to make it so. Here's a question that we get asked frequently. How valuable are these revenue streams? According to Medical Group Management Association, or MGMA as it's better known, 23.2% of a healthcare organization's revenue is accounted for by the collections from patients. That's nearly a quarter of the total annual revenue for most healthcare practices. That is significantly different than 15, 20 years ago, where it made up less than 10%. Healthcare organizations have experienced rocky and unpredictable cash flows due to the COVID-19 pandemic during the last 3 years. Although most providers have survived the brunt of the pandemic's economic impacts, it's no secret that the aptly named Great Resignation has drastically impacted patient access to healthcare coverage. Insurance costs have skyrocketed, and those living without company benefits of healthcare insurance feel the prohibitive barriers to receiving healthcare. Many folks in this boat are turning to individual healthcare plans, given the lack of employer-provided healthcare. With inflation at all-time highs and a looming recession, more than half of American consumers report being on the verge of financial disaster. However, people get sick, injuries happen, and folks still need to seek medical treatment even without insurance, despite the costs that are there. To make matters worse, patient obligation is over 50% of the healthcare dollar. Research shows that as patient financial responsibility rises, the likelihood of collecting patient payments in a timely manner significantly decreases. Here are some interesting stats for you. Nearly 20% of all Americans who receive health care get sent to collections due to outstanding bills. It's 1 in 5 patients. According to the Medical Group Management Association, MGMA again, 23% of a healthcare organization's revenue is accounted for by collections from patients, as we talked about before. To make matters more challenging, 4 out of 10, on average, appeal or fight the healthcare bill that they receive, and they succeed. 40% of patients fight their bills and succeed at that fight. As a result, 2/5 are receiving a refund or a write-off for the delinquent bills. Now, I think that coming out of the pandemic, we can all appreciate individual and family hardships, especially when it comes to debt incurred out of necessity, such as healthcare. And as much as we can empathize with these people, at the end of the day, our organizations still depend on these revenues. Healthcare providers need to get paid for the services that we provide, and that shouldn't come as a surprise. You are unable to help someone if your business does not keep its doors open. So it's imperative that we go and collect that revenue. Perhaps more shocking and concerning is that 87% of all consumers were shocked by a surprise medical bill they owed after treatment in 2021. Only 20% of all medical consumers will know what they fully owe before treatment. 73% find out the medical costs after already receiving care. On average, the medical bills that are sent to collections range from $750 to $2,600 per person. It's a huge amount of money that is sitting out there in these groups of patients that are not paying their bills. But collecting on past due AR is time consuming, and without trained professionals, it can be largely ineffective and a huge headache for providers. In fact, when we surveyed our 30,000 plus providers at BillFlash to find out what their biggest pain points were, 65% of those that responded stated that they needed help with patient collections. Now let's discuss what that means for your organization's revenue stream. In fact, let's do a thought experiment really quickly here. I want you to identify how many patients your organization serves each year. This can be an estimate, or it can come straight from billing. Either way, keep that figure in mind. Now calculate 20% of the total. Multiply the percentage by any number between the range of 750 to 2,600. Better yet, let's take the average, 1,850. No matter the size of your organization or how many patients you see in a year, the final figure you get is going to be significant. That's how much revenue you still have to fight to receive. For example, let's look at California. According to the American Hospital Directory, over the last year, California's 339 hospitals had a total of 14,334,388 patients. Gross patient revenue was $502 million, or over $500 million. Going back to our little math problem, that tells us that we can safely estimate that nearly $100 million of hospital revenue went to collections last year. To make matters more challenging, go back to that 4 out of 10 number that we talked about on a previous slide. 4 out of 10 patients appeal or fight their healthcare bill and succeed. As a result, those 40% are going to get that back out of that 500 million. There's only so much money that is there for you to collect. If you're not collecting as much of it as possible, you're missing out on a huge revenue stream that could keep your practice financially viable. Now, like we said, we believe that coming out of the pandemic, we all understand the hardships that individuals and families can be under. Financially, it's a tough time right now. And as much as we empathize, we still have to collect. And that's where practice administrators and office managers come in. It's their job to secure the financials their organization is owed. But more often than not, herding cats, even inventing interstellar space travel, seems more straightforward than having to collect payment for delinquent medical bills at times. Even with the best, most agile and diligent team members, things fall through the cracks. So what's the solution? What's the catch? Or the catch-all that can keep stakeholders happy and get healthcare organizations paid what's rightly owed to them? If any of these pain points are speaking to you, trust us, you're not alone. Collections and billing are more than just tracking down patients who may or may not know their delinquent accounts. You have to approve and review bills internally to monitor and ensure payments are deposited securely. And in the meantime, you're either utilizing a plethora of tools to try and maintain records and your sanity, or you're doing it all ad hoc with your irreplaceable and unreliable methods of doing it all by hand, trying like crazy to make it all make sense, and finding the time in the day to make that happen. Does that sound familiar to you? That's where BillFlash's end-to-end financial solution really comes into play. That's why we created BillFlash, a small practice's dream. BillFlash is a cloud-based SaaS offering that gives a proven end-to-end financial solution for every step of the patient journey, from billing to payments, and yes, now collections. We have you covered. Our integrated collection service gets your organization paid, offering your office team complete control, transparency into operations, and greater visibility into your process at the granular and big picture level. BillFlash unifies the patient statement, the collections, and the patient payment processes in concert with your organization's fiscal targets, making direct impacts on your revenue streams and solidifying business continuity. So what makes it so effective? Our foundation is in optimizing the patient billing process. Over the last 5 years, we've been expanding our services to create a comprehensive financial solution for independent healthcare organizations. We've evolved to add the following. We've added e-bills, an online bill presentation and e-bill notices via both text and email. Patients receive notifications of their texts in their inbox or on their phone. Pay services that include a model which allow you to utilize your existing merchant service accounts, known as gateway only. You don't have to change credit card providers in order to utilize these services. And then finally, integrated collections and a complete end-to-end RCM solution. Our 20-year history has informed our current and future business model. BillFlash was created by payment experts who recognize the needs of independent healthcare organizations tired of seeing their hard efforts fall by the wayside due to process inefficiencies and the lack of a unified, streamlined system. Harnessing our decades of collection expertise, we built the BillFlash Integrated Collections to be a service that utilizes effective collection methods renowned for producing the highest revenue figures. BillFlash leverages several key technologies, top-tier training, and continuous monitoring to empower your collection efficiency. BillFlash automates your entire billing and account lifecycle for online account placement using the same process used to send patient statements. It also automates payment data processes and remittances, collections management, stair-step history, and all your recovery reports. We're using the processes that you're already familiar with and that you're already using to send statements to also bring into play an integrated collection service. Because BillFlash was engineered specifically for billing and collections professionals in the healthcare industry, we ensure that the system remains entirely HIPAA compliant, especially for security provisions, safeguarding rules, and any and all confidentiality issues. Additionally, we are proud to adhere to the Fair Debt Collection Practices Act to better serve and protect patients across all 50 states, ensuring nationwide compliance through legitimate licensure and certification regarding collections. We also employ bilingual specialists to aid non-native English speakers and ensure sound communication. Lastly, our system proudly averages a staggering 81% collection rate when following up on balances that are in the 60 to 120 days past due sweet spot. This is a hard-end figure, thus demonstrating proven results. Right out of the gate, teams using BillFlash appreciate the software's customizability. For example, you can manage the rules that generate recommended accounts for collections. You determine the minimum dollar amount, aging, and more. Based upon these configurations, you can either approve or disapprove which accounts are sent to collections. You can withdraw any account at any time for any reason. This gives you the flexibility to use the processes that you're using right now to send your statements to also manage your collections. It's just as easy to remove a patient out of collections as it is to remove a statement from a batch that you upload into BillFlash. BillFlash also offers both holistic and granular levels of transparency. For example, BillFlash lets you see all the communication and activities For each open account, or when we say open account, we mean patient account that is in collections. The system automatically notifies you or your team about any pending write-offs your payers offer. In turn, you can manually approve or deny any of these offers. So the collection agency is going to be able to communicate directly with you through BillFlash, letting you make those determinations. The big difference between BillFlash and your run-of-the-mill collection agency is that we believe in getting our clients paid before we ever send an invoice. Unlike BillFlash, most collection agencies collect the patient payments and take their cut instantly. The money that remains is then sent to the practice, but it can take days, even weeks. Sometimes at the end of the month is when they send the monthly remittance back for the work that has been done. That can create confusion over the total payment made by the patient because the billing agency is taking out their cut. BillFlash offers medical organizations near instant payments once we receive payment from your delinquent patient bills. As the money comes in, it's automatically deposited into your merchant account that is set up with BillFlash Pay Services. It's not until after you've received and recorded your payment that BillFlash invoices you for our recovery fee. What truly makes us different is that we prefer a truly client-centric model. Our motto is that we don't get paid unless our clients get paid. A critical aspect of the entirety of billing and collections is the overall customer experience. I'd bet that it's highly likely that no human being ever wants to be told or reminded that they owe money for something. It's not a fun conversation to have. Whether you forget to pay a bill or can't afford to pay, it's never fun to remember that you're in debt with an organization or a person. At NexTrust, we believe that intentionality, tone, and respect go a long way in setting up a positive experience for customers and preserving the relationship that you have with your patients. We believe that it's crucial to recognize that your customers want the ability to use virtual and self-service options in healthcare, especially in our post-pandemic world. Did you know that 91% of consumers prefer electronic payment methods for their medical bills when it comes to making healthcare payments? Your customers want to use virtual and self-service payment options instead of speaking with someone directly from billing or collections. The integrated suite of BillFlash services that includes e-bills and e-bill notices coupled with BillFlash Pay Services make it easier than ever for patients to submit those payments 24 hours a day, 7 days a week. Using BillFlash is the safest, most direct online collections process available. Our team of recovery specialists uses a strong sense of decorum and tact to let delinquent payers understand their situation's urgency and urges them to get you paid. Using strategic, assertive communication allows those patients to comprehend their situation's severity and utilizes proven methods to generate revenue recovery well above industry average. With 87% of consumers indicating they wish to make all their healthcare payments in one safe place, BillFlash provides that safe, convenient, and flexible one-stop shop for your patients through our secure payment portal, myproviderlink.com. When patients are unable to pay their bills in full and for valid reasons, BillFlash allows you to create and offer pre-authorized payment plan options. Giving patients the chance to use Plan Pay ensures that you get those payments, even if smaller amounts and over time, instead of the otherwise likely amount of nothing. BillFlash offers you a complete and dynamic integrated collection service for healthcare professionals working in healthcare. Best of all, it meets you right in the middle of your current process and operations. There's no need for you to learn new workflows or generate the thousands of reports your typical collection agency requires you to send. There's no uptime and no lengthy pause for an integration process. Once you've added BillFlash integrated collection services to your account, simply upload your statements directly to BillFlash from your EHR or practice management system. That's it. The system does the rest. BillFlash can automatically recommend delinquent patient accounts to collections based on the aging that is attached to those statements and the minimum dollar amount which you select in your settings. Then you have the ability to review and select which accounts you'd actually like to send to collections. And with the click of a button, the account is sent. From here, BillFlash carries the rest of the weight. Our team of recovery specialists will directly follow up with the patients you send to us via tactful letters and phone calls. So essentially, you can set it and forget it, as our team follows up on the outstanding balances on behalf of your practice. This empowers your staff to focus on other priorities while our in-house experts use tried and true methods to bring outstanding patient balances on your behalf. Additionally, you can customize the tone, messaging, and how aggressive you want your collection service to be. If you want them to be nice and light, you can specify that. If you want them to be more aggressive, to try to make sure that they go after each and every dollar that is there and be a little harder on the patients, you can say that as well. They will be as light or aggressive as you want them to be. In this regard, we offer our customers both hard and soft collection options regarding messaging. For those curious, soft collections approaches are best reserved for newly delinquent accounts that have just gone to collections. There is a sense of urgency, but it's not as dramatic as a hard message, which provides a written consequence of being reported to credit bureaus. And of course, there's a middle ground. But best of all, you have the complete control over the messaging tone in your account settings and can determine what kind of collections temperature to employ for your clients. For example, we offer 3 levels of collection messaging. Low is a non-threatening but very clear message for the client to understand that their delinquent account has been sent to collections. However, there is no imminent threat of being reported to credit bureaus. Medium messages create more of a sense of urgency, mentioning that the patient's account remains delinquent despite multiple attempts of contact, and threatening that the patient may be reported to credit bureaus if payment is not received. However, they won't be reported to credit bureaus at this level. Finally, high messaging or hard messaging consists of best communication practices, but also includes that the client's delinquent account will be reported to credit bureaus. At this level, the account will be reported to the credit bureaus. Again, you have the full control over how aggressive you want the collection agents to be as they talk to your clients. These customizable message settings are useful collection tools considering the changes in reporting medical collection debt that were announced earlier this summer. For those unaware, as of July 1st, 2022, all medical collection debt that a customer has paid in full will no longer be included on any U.S. consumer credit reports. That said, the length of time that any unpaid medical collections will have on consumer credit reports is now increased to an entire year, as opposed to 6 months. So think of it this way. Your delinquent accounts now have double the time to address and resolve any owed payments before the debt gets reported. From our experience, the sooner you send a delinquent account to collections, the more likely you will be to recoup the money that you're owed. So now you're probably wondering, could it really be as easy as Tony's saying? And how much does this system cost me? That's where it gets better. We don't ask that you pay us until your practice has been paid. You heard that right. There is no cost to add BillFlash's integrated collection services until we collect payment from your patients. We remain steadfast in our efforts to track down your delinquent clients, giving you your internal teams more opportunities to provide your organization with more meaningful work. Imagine what your office management teams could do with this much time freed up. They don't have to go collect on that outstanding debt from patients that haven't paid for a couple of months. We're not saying that they lose their job. We're saying that they have time to do the things that they're not doing right now. And I have never met a medical practice that feels that they have enough time in their day to do all the things that they need to do. All right. We've set aside time for any questions that may have come up. You can schedule a demo at any point in time for you or your customers at BillFlash.com. If up at the top, there's a schedule a demo that will let you select prearranged times where our sales staff is able to give you an in-depth demo of how exactly the collections are going to work with your systems. Those demos are very easy to schedule, so I would encourage you to schedule one if that's something that you're interested in. And if you are a reseller, you can work with Jacqueline, and she'll get you a landing page where your own customers can schedule their own demos of these things with our sales representatives. So there's a lot of different options that are there for you. We believe that this is an outstanding service. It is growing in leaps and bounds right now. We have had huge growth in the number of accounts and the dollars that are recovered over the last 3 months with collections. So there's very little in it to lose by trying it. There's no payment due up front. It's something that if you want to cancel at any time, you're able to. So I would encourage you to reach out to your sales representative or schedule a demo today at BillFlash.com.